When we read, our eyes have to work together as a team. When we look far away, our eyes are parallel. When we read, our eyes cross in towards our nose. That's called convergence. We have to be able to keep our eyes in that crossed or converged posture easily for reading to be comfortable. Ideally, reading is visually effortless, but when kids have difficulty using both eyes together as a team, they experience headaches, double vision, blurred vision, eye fatigue, loss of place during reading and close work. Eye teaming is a crucial part of visual stamina and really affects our ability to read for longer periods of time. The two most common types of eye teaming problems are convergence insufficiency and convergence excess. With convergence insufficiency, our eyes have difficulty staying in a cross position for long enough for reading to be comfortable. With convergence excess, our eyes over-converge. Convergence insufficiency is the most common type of eye teaming problem. It's present in about 5% of the population, which means that in every classroom, on average, a classroom of 20 kids, one of those kids has convergence insufficiency. Eye teaming problems make it a lot harder to pay attention during reading. We've all had the experience of reading when we're tired. You read a page or two and you think, I don't remember anything that I just read. That's normal when it's 10:30 at night. You're using some of your attention span to stay awake. Kids with eye teaming problems are using some of their attention span and extra effort to make their eyes work during reading, which reduces their ability to remember what they're reading. We have a limited amount of attention for any activity, this much attention. If we're using some of that attention to stay awake or to make our eyes work, we have less attention left over for what we need to remember, comprehend what we're reading. The two most common behaviors that we hear from parents of kids with eye teaming problems is they hate to read and homework is a nightmare. The reason they hate to read is because the longer they read, the harder it gets, and they develop avoidance patterns around reading. Homework can often become problematic because at the time homework rolls around, kids are even more tired, more fatigable, faster than they were even during school. Younger kids will often not verbalize complaints about headaches or eye strain, but they will show signs of fatigue by rubbing their eyes, blinking, squinting, holding material closer, even covering or closing one eye when they read. Some types of eye teaming problems can be helped with reading glasses or prisms, but vision therapy is another treatment option that's very effective for eye teaming problems. Convergence insufficiency, in fact, vision therapy is the treatment of choice for that. If you'd like to learn more about vision therapy, look at our vision therapy video, or you can also look at the vision therapy tab on our website.